Oberon is so unwell and struggling to walk, his owner's mother and daughter, Sue and Susanna,
He's a good boy.
have asked Scott to make the special house call.
Hi, Sue.
Hi, Scott.
You're all right.
Thank you so much for coming so quickly.
It's okay.
Come in and see Oberon. He's really not very well.
Okay.
Please come in.
All
Thank
right.
you.
Will do.
Oberon's in here.
Hi, Obi. Hi, Susanna.
Hello,
How are you? You're all right?
Thank you.
Hello, champ. What's been going on?
Last Sunday, he went out into the garden and collapsed in the flower bed. It started off with a choke.
Coughing, yeah, and then his gums went pale and then it was going blue and he wasn't breathing.
And it was an awful, awful, desperate situation. We thought we might actually even lose him. So it was really frightening.
I can imagine. Yeah. And has he shown any other symptoms that have carried on?
Yes, well, when he gets a bit agitated, especially when there's food around, he's expecting to be fed, he sort of starts jumping about. And then he finds it difficult to breathe and starts coughing a bit. So, yes, we're very worried about him.
Has his bark changed at all?
Definitely, he's become more hoarse.
Yeah, it's much hoarser, quieter, yeah.
Yeah, it's not as loud as bark anymore.
Yeah.
Okay. Well, there's a number of possible respiratory conditions. There's some cardiac conditions, of course, it could be. But the concern that I have is that he may have a condition called laryngeal paralysis. He's got all the classic symptoms and also he's got an old boy, and it does tend to happen in older dogs as well. The larynx is the cartilaginous box, the voice box in the throat, and the nerves that supply it sometimes fail to work. And as a result, the larynx is then unable to open properly to allow a decent amount of air into the lungs. So it means not only does his bark sound different, but he's actually unable to open his airways up enough to take in enough oxygen.
Yeah.
So any form of heat or any form of stress leads to this old boy having some problems. Hey, buddy. I think the fact that Oberon has collapsed in his very own garden, just doing what old dogs do, which is not much, is incredibly concerning. And I do feel that I need to take him to the practice to understand this condition more and work out exactly what we're going to do to fix it. Good boy. Out we go. Come on then, buddy. Come on.
We've had Oberon all his life. We got him when he was a puppy. If we lost Oberon, I think we would be absolutely heartbroken. We know he's an old boy, but he's so loved and he's part of the family.
Let's go to the practice. Good boy.
Don't worry, darling, be all right.
Jack, come here.
Jack, can I have that ball, please?
Come on, puppy. Come on. He's a good birthday boy.
At a local park, it's Springer Spaniel Jack's birthday, and he's enjoying a play in the sun
Good boy.
with his devoted owner, Francine,
Oh, he's nearly got it.
and her partner, Joe.
It's behind
Jack,
you.
where's the ball?
Jack.
Where's the ball?
He's 12 today. We adopted him when he was 6 months old from a sanctuary back in Oxfordshire.
Good boy.
I was about 13 at the time. So I've grown up with Jack.
But birthday celebrations have been put on hold because Jack needs surgery.
Good boy.
Jack's always been a really healthy dog, but when he was about 4, he developed a fatty lump on one of his back paws.
Good boy.
We've been told that those lipomas, they're harmless, so you can just leave them unless they're causing other issues.
Go on then.
Oh, you're excited, aren't you?
He's had quite a few pop up over the years.
But now I think the ones on his shoulder are getting so big that they're getting in the way of his legs and his walking and things.
Go on then, Jackie.
Francine is terrified at the prospect of her much-loved boy undergoing surgery after a previous scare.
Good boy.
It was the anaesthetic he reacted to, but he was out of it for quite a few days. So he'd get up to walk over to you and fall over or vomit. It wasn't very nice. He was really poorly.
Come on,
Go on,
Jack.
Jack.
Let's go for a nice walk.
I'm really nervous about taking him to vets. He's my only Jack. Jack means the whole world to me. He's my best friend, no offence. And I don't know, I just can't imagine not having him around. I love you, Jack.
He is our extra housemate.
Yeah, massive part of the family.
Jack has an appointment with Scott tomorrow for the lipoma surgery.
You gonna be a good boy tomorrow, Jack? He's a good birthday boy. Good boy.
Be careful when you're picking him up, but we need him up here on the table, please.
Okay.
Good boy.
Come on, lad.
Yay, good lad. Well done.
At the Richmond Practice, Scott needs to find out why elderly dog Oberon collapsed at home and has been struggling to breathe.
So we're going to have to take some of your blood, and then we're going to try and do some x-rays. Okay, good boy, good boy, good boy.
Nurse Nathan will be assisting with Oberon's tests.
Good boy.
Chilled, aren't you, hey?
That's it. Good boy, Obi, well done. Well done.
Scott suspects the 13-year-old's breathing difficulties may be due to a paralysed larynx.
Right, okay, sweetheart. Good boy, stay still. Big boy.
X-ray.
Yeah.
But first, he has to rule out any other possibilities.
Just taking some x-rays of Oberon's chest just to see if there's any reason for his sudden collapse and his respiratory issues. So his lungs are pretty clear, his heart looks normal, so the problem isn't in his chest. Blood through yet, Nate?
Just bring them up.
Wow, he's a pretty healthy boy. Looking at the blood test, generally, Oberon's an incredibly healthy boy for 13. I mean, it's a great old age for a Hungarian Vizsla. I hope our blood's looking like that when I'm his age. It's pretty good. Doing the x-rays and all the blood testing that we've done has basically ruled out every other possible cause of Oberon's respiratory distress besides laryngeal paralysis.
Scott is hoping to avoid surgery on the elderly dog, so he's called his good mate, specialist surgeon Michael Hamilton, for a second opinion.
Hey, Scotty.
Hey, Michael, how are you, mate?
Yeah, I'm good. Oh, he's not as bad as I thought he was going to be.
Well,
You're paying for my speeding ticket, mate.
fair enough. Well, his owners are pretty worried. He did collapse at the family home a week ago.
Yeah.
And he's showing some fairly classic signs of laryngeal paralysis. So his bark has changed. He's doing a strange sort of throat clearing.
Yeah.
And every time he gets excited or stressed,
Yeah.
he starts having issues with his breathing and struggles to get breath.
Yeah, change of barks, highly suspicious.
Yeah.
Can I just have a quick listen to him?
Absolutely.
Yeah, he's pretty raspy around his larynx, isn't he?
Good boy.
He's nice and relaxed on his meds, isn't he?
Yeah.
But a little charge around the park and he goes blue, right? Yeah.
That's pretty much it.
You got his x-rays and things?
Yeah, so we've taken some chest x-rays. They all look fine. But what we need to do, of course, is give him his anaesthetic. So I thought I'd wait for you.
Yeah, and have a look.
Before making a decision on whether or not to operate, Scott and Michael need to have a close look at Oberon's larynx to see how well it's functioning.
Okay, sweetheart.
For this, he's been given just a light anaesthetic.
To fully assess Oberon, he needs to actually be awake, which does mean that he can bite down on our hands as we're checking him over. Watch your fingers, because it's going to be quite light.
He will be chompy, so...
Okay.
So look. So when he breathes in, what should happen is his airway should open.
Yeah.
If it's paralysed when he breathes in, he sucks it closed. So, Nath, tell me when he's breathing in and breathing out. So go in and out as he breathes in and out.
In, out. In.
Yeah, it's not doing much.
In.
Looking down this dog's airway, there's no movement at all. And so as he's trying to breathe, his airways should be pulled open. But actually what happens is they just sit there. And as he breathes and sucks air in, they actually get sucked closed. So he's got bilateral, both sides, paralysis of his larynx. And dogs can die from this. So it's a bit of a ticking time bomb.
Right, so surgery it is then?
Yeah, sure. Right.
Okay.
I'll go get changed, mate, if you go get a tube.
We'll do.
See you in a
All right, see you in a second.
Oberon will now be given a full anaesthetic, and Scott and Michael can immediately proceed with the delicate surgery.
The procedure that we're going to be performing today is called a laryngeal tieback. It's a very complicated procedure, and it comes with lots of risks.
I'll just be there to tell you to cut that cricotinoid.
Yeah.
That's the only scary bit, really.
Today I'm going to be the lead surgeon, but Michael is very much my able right-hand man.
So keep feeling for that wing of the thyroid, because that's basically where you're aiming. That's where you need to go to. There's some big things in there, jugular veins, big nerves. So yeah, you just got to make sure you know where you're at.
I'm ready to go.
Go for it, matey. Stage one, rule one, don't cut the jugular. Go for it, matey. That's it.
Just want to cut that.
Yeah, and then a little bit backwards.
In Richmond, Scott and specialist surgeon Michael Hamilton have started life-saving surgery on 13-year-old Vizsla Oberon.
So there's some decent vessels in here, so just be careful.
The elderly dog's larynx isn't opening properly, and he's been struggling to breathe.
See that little fella?
Yeah.
Don't want to cut that.
No.
That's the branch of the jugular, so I'll get him up here out the way. There you go.
The procedure is something called a laryngeal tieback. It's incredibly complicated with a whole bunch of muscles and a lot of really important blood vessels and nerves around. So it does make for a very risky surgery.
Now for the really scary bit. So you've got your process there. And if you put your finger just behind that muscular process and there's a little depression, that is actually the joint that you're going to disarticulate. And then we're going to stitch the arytenoid in a different place. Yeah. But it's quite a tough joint, but it's a joint nonetheless. You need to just free it up a little bit. So just use your forceps on there and then just cut forwards just a little bit. That's it. That's lovely. Nice work, sir.
So we're at a pretty pivotal stage of the surgery. What we've done is separated the inner bit of cartilage, which means that I can now grab hold of the muscular process we uncovered and actually then lasso it to that middle cartilage. And by doing so, we're opening up the larynx and pulling away that vocal fold away from the centre.
That's it. Nice. So you just got to tie it now, and that's it.
Yep.
I'm just going to hold that ever so gently like a finger on a parcel. Done.
Nice.
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 Happy with that.
Nice.
Or
mate.
as the Geordies say, lush. So there is our laryngeal tieback, a massive surgery with lots of complications, and all it boils down to is just one little suture that's going to make all the difference in the world.
Good job. Looking good.
I'm just closing up, so Oberon says thank you, and so do I, but you can head off.
No worries. No worries.
Thanks, mate.
Okay, all good. Mate,
Nice working with you.
I'll see you soon. Bye, mate.
See ya.
It went well. Didn't cut any white stringy things, as in the nerves. So best case scenario, future for Oberon is he will wake up and can't believe how well he can breathe. And within a couple of weeks, just when everything's settled down, he's flying around the park like he never has done before.
Okay, now to see if the job's done. Oh yeah, look at the difference, that's massive. It's a massive relief to actually see that his larynx is now much more open. This is an old boy that's had a great life, and I want him to have a life going forward. And he can only do that when he has an open airway. And now, thankfully, he does. That was a long one, wasn't it, mate? Hey?
Oberon will spend the night under observation at the clinic to make sure he's fit enough to go home to his owners in the morning.
You huff and you puff, old boy, hey? At least you can breathe now. Yeah. No more collapsing for you.
Nathan, look at the baby.
Downstairs at the clinic, new mum Ellie and her two fragile newborns are getting some TLC with nurse Nathan and practice manager Maz after being brought in for a health check.
That one's a bruiser. It's the bigger one. I make you.
Ellie's owner Victoria has had a worrying few hours, concerned that the new little arrivals aren't feeding properly.
They are pretty small, or one is especially. So, yeah, I'm quite nervous about that.
The young Bichon Frise gave birth overnight.
Good girl, Ellie.
But so far, her two little pups have been unable to latch on by themselves for their all-important first feed.
Come on, Ellie, look. Gonna feed the babies. Come on, sweetie, see if you can do it. Oh, good girl, Ellie.
So Nathan and practice manager Maz are helping out the first-time mum.
That's it. Just a little more down there, sweetie. Come on. Oh, nearly.
You got it? Yeah, well done.
Got it. Oh, there we go.
It's amazing. No one teaches them, and she's there feeding her babies. It was all just this really beautiful thing to actually witness. We got them both on?
Yeah, that's two.
Holding those tiny pups is just like nothing else. They're small, their eyes aren't open, they're just brand new, tiny little balls of yumminess that you just kind of want to squeeze harder than you should.
With the pups now feeding well, a delighted Maz can't wait to show owner Victoria the hungry little boys.
Hello. Wow. Thank you.
Proud mummy moment.
Yeah. Well done.
Been a very good mummy.
I'm very proud.
To walk out my office and see this beautiful mum with her two lovely tiny little puppies, it would make anybody's day, but I've got to say it's the perks of the job that you get every now and then, just getting that little insight into brand new life in the world.
With full bellies and a clean bill of health, the contented pups are now ready for a snooze. The new little family will head home with Victoria later today.
Well done.
Such a clever girl.
Oh, yum. Good boy, well done. You're breathing very well this morning, aren't you? Hey? Yeah.
Oberon is recovering well from his big surgery.
Good boy. Hey? Wouldn't know you've been through a major surgery. Hey, no you wouldn't. No.
Yesterday, the 13-year-old Vizsla underwent a risky throat operation to correct the paralysed larynx that was closing his airway.
Yes. Wait a minute. There we go. You got very nice table manners. Good boy. Yeah. Take it nice and easy. Yeah. Mummy and Grandma will be here soon.
So excited about seeing him. Yeah.
Owners Sue and Susanna have arrived at the practice and can't wait to take their old boy home.
Hello. Hello.
How are you doing?
We've come to pick up Oberon.
No problem.
Yeah,
Do you want to grab
thank
a
you.
seat for me and
Thank you very much.
All right, cheers.
Last night was terrifying. We were really nervous, waiting to hear how he was, how he's pulled through. Can't wait to see him. So excited.
Who's this?
Here he comes. Oh, sweetheart. Hello.
Hi, guys.
Hi. Oh.
And here's your boy.
Hey, baby.
Hey.
Hello, baby.
Oh, yes.
Hello.
Who's that?
Okay, my lovely.
So he's done very, very well. He's obviously going to still be making a little bit of noise after the surgery,
Yeah.
just because of the fact that he's had a tube down his throat and also major surgery on his neck. But I'm very happy with the result. The surgery went really well, and now his larynx is tied back on the left-hand side. So it's basically like if he's got sliding doors, one sliding door is now pulled in the open position all the time. Now that Oberon's going home, he does need some very specialised care because basically he has an airway which is permanently latched open. So he is exposed to the possibility that he could breathe in food and cause severe distress. So one thing Sir will be requiring is his food needs to be now hand-fed.
Yeah.
You need to roll it into little balls and he's going to be fed at head height. So you get the royal treatment you are, yes. Hand-fed by your own personal butler service. Yes. But other than that, this old boy should make a full recovery and be bounding around the parks of Richmond very soon.
It's such an almighty relief, isn't it?
Hey, you're not perfect, but you can breathe.
Yeah.
And that's all we want. That's all we want, isn't it? Yeah. All right. Bye, buddy. Take care.
Okay.
We'll see you soon. Bye, buddy. See ya. Bye. See you later. Take care. All the best.
Bye-bye.
See ya.
Thank you so much.
Bye.
Bye-bye. Come on, boy. Wait, come on, this way. Come on. That's a good boy.
Come on then, Jack.
Francine and her partner Joe
Take you out for your big day, Jack.
have arrived at Scott's Richmond clinic with 12-year-old Jack.
Hi, guys. How are you?
Good, thank you.
And this must be Jack.
This is Jack.
Hello, mate. I hear it was your birthday yesterday.
Yeah.
And look what Mum and Dad got you, a vet visit. Right. Well, shall we go into the consult room and have a little chat?
Come on, Jack.
Come on, then.
Good
Come on,
boy.
buddy.
Come on. I didn't really sleep very well last night, so anxious about what was to come today.
Okay. I'm just gonna get him to stand up for me. Good boy. Yeah.
It was a long journey here. The whole time on the train, I sat on the floor and cuddled him. I was just so nervous.
So obviously he's got lots of lumps and bumps everywhere. How are they affecting his quality of life?
They weren't, but this one in particular has gotten so big, he gets a bit limpy.
Right.
And you can tell he's uncomfortable in certain positions when he's laying down.
Yeah, that's fair enough. I'd be uncomfortable if I had that big lump there.
Yeah.
I'm not concerned about what they are. I'm pretty certain they're going to be benign. But the only issue with them is when they're just getting in the way of normal function and movement. And I think that's exactly what's happening. Is that one there, he's got like a big football on his shoulder, and so he can't actually extend his leg forward. And he's also got this one here, which might be doing the same in reverse, actually, because it's sort of over his shoulder blade there. What I'm finding on Jack is very large lumps of fat growing on his body, and those lumps are called lipomas. That's a benign type of tumour. They're causing a change in the way that he walks. And for an old dog, that's a problem because it can encourage arthritis.
I think if we can get rid of that, he can have a good quality of life in his twilight years.
But of course, we have to address that not small issue of anaesthetics in old dogs.
Yeah, he had a lipoma removed actually when he was about 4, but he didn't take too well to the anaesthetic. He was quite unwell, sort of being sick, couldn't really walk straight, so it was quite a worrying time. So hence why I haven't had any of them removed so far, because they've not been causing him too much trouble, and I just don't want to risk losing him.
Yeah, so now it's become critical mass.
Yeah.
And it's forcing you to make that decision, but I can see in your eyes you're quite nervous, aren't you?
Yeah.
It's better if we just be strategic, work out which ones are the most important and which ones could wait. So I think that one and that one, big enough on their own, but I would definitely try and remove both of them.
Yeah.
I just think we don't want him to grow old and be in discomfort.
No, exactly. Yeah.
Yeah, yeah. Says Mum with a worried look on her face.
She's scared, you can tell, can't you?
Jack's not had an operation for a really long time, and now he is that bit older, I just worry so much about him. So my stomach's in knots, really.
I appreciate that you have trust in me regarding the anaesthetic.
Yeah.
But I appreciate it's a big thing for you guys. So you need to say goodbye to your boy.
Okay.
Oh, Jackie.
Hi, Jackie. The pressure's really on for Scott, because this boy means a lot to us. He's 1 in a million, and he's got to save my boy.
Come on then. I'd say it's a big lump, but I think it's a bit rude because he actually has some lumps.
Wow.
Mate.
Who's this?
This is Jack, and Jack has some lipomas, which you can very clearly see. Yeah. So we're going to take them off, aren't we? Yeah, okay. Let's get going. Now, just so you know, with this guy, previously he's had a bit of an issue with an anaesthetic. He struggled to recover, so we do need to just be quite careful about what drugs we use.
You never give me easy anaesthetics, can I just say that?
Well, you're very good at your job, Nathan, so I think you need a challenge. Just give him a breath of air. No?
Seconds later, Scott is suddenly alarmed.
Come on. He's not breathing. Just give him another breath of air there. As the seconds tick past, my concern is rising because at any point his heart can stop. Come on, mate. Come on. Come on, mate. Heart's still strong because it's not breathing.
Yeah.
Come on, mate. Don't be lazy. Come on.
In Richmond, elderly Springer Spaniel Jack has stopped breathing just moments after being given anaesthetic.
Just give him another breath of air there. This is an old boy. He responded badly in the past to an anaesthetic. He's doing the same thing again, even though we're using different drugs. Let's just flip him over and see if that makes a difference. Yeah, so we're just giving him some oxygen because he's just not breathing at the moment, so we just need to keep trying to encourage him to do so. The longer this process goes on, the more concerned that Jack simply will not survive this anaesthetic. Come on.
Oh, there we go.
There we go.
Yep.
Oh, bloody hell. I felt like I held my breath for about 3 minutes then. I'm like a deep water diver. It's been a very stressful 3 minutes. I've definitely got more grey hairs, and Nathan's definitely lost more hair as a result of this anaesthetic. I think we need to just work quickly, get these lumps out as quickly as possible, and watch him like a hawk. Okay, so cutting.
Scott is removing 2 massive lipomas, or fatty lumps, from Jack's shoulder.
Look at that. Wow. It's a whopper. So you can see now it just wants to come out. It's like a nasty pea in an inappropriate pod. Come on. Here we go. Look at that.
Wow.
Huge. So that's one done. One to go. Here we go. Wow. Absolute whopper. So no wonder he's sore, because it's actually stretching the muscle above it. So to remove this is going to make a big difference to the quality of this dog's life. It's massive, isn't it? That. It's pretty weighty as well.
Bit of weight loss surgery there.
Yeah. Okay, closing up. Interestingly, the lipomas, they were growing within muscle, which means that they would be causing quite a degree of discomfort. So actually it's incredibly rewarding to remove them, because I know that Jack is going to wake up a far happier and more comfortable old boy. You gave us a bit of a scare there, didn't you? Eh? Yeah, massive relief to have this guy awake. He was a challenge, I think is fair to say, but worth it, because he is going to feel so much better now those lumps are out, and so am I. He's like, I'm still disappointed about this as a birthday present. That is an awful birthday present surgery.
Oh. I think we all deserve some cake after this.
I think so. Come on.
Jack will sleep off the anaesthetic before going home later today.
Good boy. Thankfully, Jack is waking up very, very nicely for an old boy, but this anaesthetic is done. I definitely think that Nathan and I have earned a beer tonight. You good boy. You can't have a birthday without a beer, can you? No, you can't.
Hey, Scott.
Hello, mate.
I've got a present for you.
Oh, you shouldn't have.
I've had these left on the doorstep, and I'm hoping you can do something with them.
Okay, well, sounds like a bird, at least. Should we have a look and see? Wow. I've got a good idea what species of bird they are.
Vet nurse Nathan has found an unexpected package left anonymously on the clinic doorstep.
You are destined to actually be a pigeon, aren't you, sweetheart? Oh. Generally, as a vet practice, we see mostly dogs and cats, but we are open to all creatures, great and small, and sometimes we're quite surprised by what walks through the door. And today, Nathan's brought down some very small baby pigeons. Hello. Did your mum forget where she put you? Did she? Eh? Right now, I'm quite concerned for these little baby birds. They have been exposed to a lot of stress. Their immune systems would be weakened, and obviously without mum, they have lesser chance of surviving.
So how old do you think they are?
Oh, they're young. So started to get some of their feathers though, so I'd say a few weeks, yeah.
Still got the little egg tooth, hasn't they, at the front?
Yeah. Oh, I know. Should we give you a little bit of food, eh? These baby birds need really intensive treatment and care. They need to be fed about every 3 hours around the clock, just as mum would. Here you go. A little bit of food. We're using some baby porridge, which has some long-chain carbohydrates in it. It's a good form of sustenance for a baby bird and warms them up a little bit as well. I know, yeah. There you go, have that. Good bird. Well done, that's it. Here you go. Is that delicious? Yeah. Ooh, yummy, yummy, yummy. Well done, well done, well done. Yeah, how's that? Has that made you happy? Feeding these little baby birds is quite a delicate process. They do seem to be taking the food quite well, and you can see immediately that they are responding, they're brightening up, and they seem happy in a warmer environment. Okay. Wow. Hey? Oh, goodness me.
I like the fur on the back there.
Sort of the yellow afro you've got going on there. Come on then, you. Let's feed you up. Eh?
With the little birds responding well to some warmth and food, a volunteer from London Wildlife Protection is on their way.
Still worthy of a chance, aren't you, gorgeous? It's always lovely when the public bring in wild animals for us to look after, but so often they should just leave them alone. The mother generally knows exactly where they place their babies, and if you don't touch them and put your scent on them, they will come back and look after their own babies. Hey, Chris, thanks for coming so quickly.
That's all right, no problem.
As is the season for baby animals, I've got two...
Oh dear, they are babies, aren't they?
Yes.
Indeed. Excellent job.
Thanks for coming and rescuing them.
That's all right.
You're a good man.
Pleasure. That's what we're there for.
Now that we've fed the babies up, I'm really hopeful that they will grow into full-blown, beautiful pigeons. They've had a very tough start in life. It's a tricky road for them to go down, but hopefully they'll be fluttering around the skies of London soon. Okay, then you two. You little kitties, aren't you? Good bird. That's it.
They got a good chance, haven't they?
Nice one. Thanks for dropping
Thank you very
by.
much.
See you later. You look after them for us.
Cheers.
Cheers.
See you again.
Bye.
Bye-bye.
The little orphans will be taken care of until they're strong enough to be released into the wild.
Bye, guys. Right, champ, how you feeling? Are you a good boy?
Jack is fully recovered from his anaesthetic, and now it's time to go home.
Let's go and see Mum. Good boy.
Hope he's doing okay.
It's been an anxious wait for Jack's owners Francine and Joe.
Hi, guys. Here's your boy. Hey. There you go. Lucky. Hello. Hello.
You happy little thing.
Oh, thank you so much.
He's doing good.
Oh, God, I'm so relieved. I've never been so nervous. It felt like the longest few hours of my life, but I'm just so relieved to have him back to normal. He's a little bit dopey, but he looks really good.
So, as you can see, he's looking quite svelte now. He's lost a little bit of weight. Do you want to see what he lost?
Yeah.
I warned you.
Got a strong stomach, it's okay.
So there.
Wow.
Wow. Oh, poor Jack.
So they're just fat?
Just fat.
Yeah. To have that much weight on either side of one joint, you really understand why he was struggling and why it was having such an impact on him. Must have been really making him uncomfortable. So he's going to be so much happier now.
All right. You going to get up? Time to go. Come on, then. Come on, there you go.
Have a proper birthday party
Good
now.
boy. It's still a pretty rubbish birthday present. He couldn't even have a cake, bless him. I have to give him one. Bye, Jack. Oh, he's very keen to leave. See ya.
Bye.
A nice old boy.
Here we are.
Luca and Trish have arrived at Scott's Isleworth clinic with a special little passenger.
Hi. We're here with Pepe.
Where is Pepe?
He's in the bag.
Oh, let's see him.
There he is.
Hello. Oh, look at you. Should we have a cuddle?
Little guinea pig Pepe is unwell, so he's been booked in for an appointment.
Oh, what's all that noise?
Hi, Trisha. Hi, Luca.
Hi.
You've given little Pepe to Jeannie. You're never going to get it back now.
Wow.
You love a guinea pig, don't you?
I love guinea pigs. They're my favourite, aren't they?
Hello, mate. Hello.
Guinea pigs are an incredibly popular pet here in the UK. They're a great family pet. They're a lovely, friendly animal. They're great with kids, but they're really good also for people that don't have gardens and have a small space to live in. Come on, guys. Let's pop on in.
Okay.
Come on.
Luca and Trish are so devoted to Pepe, They've learned how to communicate with the little guinea pig.
They've got excited, which is busy, which is
It was Pepe's sounds that first alerted them that he wasn't well.
Are you a little bit uncomfortable, mate? Are you? Hey? Let's just have a little head-to-toe examine of you. If I get one of you just to hold him around the shoulders there.
So when he pees, he makes a weaking sound, which sounds a bit like... So I can tell he also hunches his back a little bit when he pees. I'm very worried about him, you know. It's like when your child is sick, you just want them to be happy, you want them to be healthy.
Are you okay? Let's spin you around. Hey, look adoringly at Mum and Dad. There we go. All right, I'm just going to have a little feel of his tummy now. Straight away he's uncomfortable at that, isn't he? Oh, you don't like your bladder being touched, do you? I mean, fair enough. If you're up for it, I think what's probably a good idea is I'll just do a quick ultrasound. We'll have a look and see if there's anything lurking in that little guinea pig bladder of yours, my friend. Let's have a little look, shall we? So, can you see that black circle? That's the bladder. So what it is basically he's got what looks like a little stone. Urinary calculi or bladder stones occur in guinea pigs for a number of different reasons, but most of the time it's dietary. There's lots of different foods which have high levels of calcium that people are unaware of. A lot of green vegetables, for example, so they feed them, guinea pigs happily eat them, and then they accumulate the calcium in their bladder and they lead to stones. So it's 3.64 millimetres, which is a decent-sized bladder stone for a guinea pig. And if you kind of extrapolate that out to a human, you're probably looking at about golf ball sized. So we are going to have to perform surgery on your little Pepe, I'm afraid.
Okay.
Yeah. He's not going to be able to comfortably pass that.
No, and he's uncomfortable now with it as well, so...
It's the only option.
Yeah. I'm worried, yeah, because it's a big thing for a little animal like that to go through an operation.
You need to say goodbye to your little guy now because I need to take him downstairs and get that stone out.
All right.
Chap.
Good luck.
Good luck, little fella. Be a very anxious few hours, I'm sure.
Hello, ladies.
Hello.
Got little Pepe with me. Here you go, look.
Hey.
There's my rhyming team of Gina and Tina.
Yeah.
There they are.
Oh,
Hey.
your little paw.
It's time for the operation to remove a bladder stone from 3-year-old guinea pig Pepe.
Okay, here we go. Good boy. Good boy. Guinea pigs, they are quite prone to stress and they are nervous, very delicate creatures. So, of course, everyone's a little bit nervous today. You're all right, sweetheart. We use the anaesthetic gas in a box, so Pepe goes in there and hopefully goes down nice and quickly. So if you take the lid off, and then Tina, if you lift him out for me. That's it.
Good boy. Small mammals are generally very fragile when it comes to anaesthetics, so we have to take extra precautions and just be as fast as we can.
So I'm cutting now, okay?
Yep.
So you just flinched a little bit there, so you just turn him up.
Put him on 4.
Yep. So there's his bladder there. It's quite large, very thick, very angry bladder. Once I cut through the bladder, I then go on a little bit of a fishing expedition. I did used to love fishing as a kid. Take yourself off and enjoy the sights and sounds. I think it's good for a kid to learn a bit of patience, you know, as well. Oh, there he is. Yep. There you are, you naughty thing. It looks pretty tiny on my finger, but for a guinea pig, that is pretty large. So I think it's going to make this little boy much, much more comfortable.
Well done. When Scott pulled the stone out, initially I thought, wow, it looks really small. But if you think about the size of the guinea pig and then the size of the stone, that bladder stone is relative to a golf ball sized bladder stone in a dog or cat.
Now I'm just popping his bladder back into his abdomen where it belongs, close him up, and back home to mum and dad. Tina and Gina have done fantastically well monitoring this very delicate creature very closely to ensure he gets through it. Let's wake him up.
You're now stone-free, Mr. Guinea Pig. Let's have a nice, smooth recovery, please.
A stone lighter.
Yeah.
Pepe is woken up very well. So now it's time for me to call Trish and Luca and give them the good news. Come on then, little man. Let's get you back to bed. And I'll call mum and dad. Good boy. Hello, buddy. I think I heard them upstairs. I think your lift's here. Hey, come on then.
Later that day, guinea pig Pepe has recovered well from his anaesthetic and is ready to go home.
All right, let's go.
When Scott rang, I was so relieved. I had such a heavy heart all afternoon, I couldn't eat. So yeah, I'm happy to be here to hopefully take him home.
There you go.
Hello, little boy. Hi, mister.
Say hi. Lovely day at the spa, getting some massages, losing a bladder stone, that sort of stuff. And all I would say is, in future, to try and prevent this from happening, is to try and consider just reducing everything that has calcium in it to a degree. So focus more on the hay and less on the pellets. I think that we should get a really good result here.
All right, will do.
Hey, come on then, you come to me. You've got a bag there from Luca, as always. Come here, sweetheart. Good boy. All right. See you later. See you later. Be a good boy. Back in your bag. There you go. Good lad.
Thank you very much.
No worries, my pleasure. See you later. Hello, guys.
Who's that?
A lovely, relaxing family picnic. Yeah. Hello, my boy.
And
How are
Scott
you?
now has a special belated birthday
You
surprise
seem happy
for
enough.
Springer Spaniel Jack.
Great to see you. How you guys doing?
Good, thank you.
All right?
Yeah.
The elderly dog has recovered well from surgery to remove fatty lumps that were inhibiting his movement.
Well, I know that I kind of ruined his birthday a little bit. So I've bought him a little birthday cake. I'm just going to show it to you, but you can't have it just yet. Yummy.
Ooh, lucky boy.
Now, before I give you my treat, can you give me mine? I just want to know how he's gone after the surgery.
He's doing amazingly well, yeah. It's fantastic.
Yeah?
Completely changed him.
When I'm taking Jack for a walk now, he can keep up with all the little puppies and he just seems so much freer and happier.
The weight off his shoulders and a weight off our minds, really, yeah.
What I would quite like is to see him move. So if it's okay, I might pop myself over there. I'm going to offer him up his cake and then we'll see you run. I'd love to see you run and move, my boy. I did feel quite mean in not letting him have any kind of birthday cake or treat before the surgery because we needed to starve him, of course, to get that done. But now is another day. He seems a lot happier, so I think he's deserved his birthday cake. All right, my boy, you ready for this? Okay. Happy birthday, buddy. Come on, let's see you move. Oh, wow, look at you go. Look at you go. Jack is a Springer Spaniel who loves his food. So, of course, he's going to want to scoff the food straight away. But the good news is he's running very smoothly, very comfortably. This is a happy, healthy boy.
I don't think I've ever seen him enjoy food as much as that.
He's so happy.
Look at that, eh? You can have your cake and eat it now, can't you?
Oh, Lily, what are we going to do with you? Hey, what are we going to do with you?
Scott's first two patients are in Teddington. Sisters Pickle and Lily are waiting with their owner Sally.
For the last year or so, they have been a bit incontinent. Well, for most of their lives, we've noticed little bits of dribbling, but it has started to get worse to the extent now that quite often they're lying there and you just literally see urine dribbling out of them and they've absolutely no idea that that's happened. So, yeah, it's starting to get quite annoying now, not to mention very wet and smelly.
Sally and her daughter Katrina love their two girls.
Who's my big boy? Yeah, look at me.
But the constant leaking is out of control and they're desperate to get it fixed.
Poor little pickle.
And now she's weed on me.
Oh, looks like I've wet myself. It's just a normal day in the household, eh? I'd really like to have two dogs that don't leak all over the floor. I'd like to be able to walk into my house, sit down on the sofa and not shoot straight back up again with a wet bottom. So definitely hopeful that Scott will get to the bottom of all of this.
Hello, Sal. How are you, mate?
Good, how are you?
I'm really good. I'm looking forward to seeing these girls.
Well, please come and meet them.
What is that smell, Sal?
Oh, sorry.
There's a serious pong, isn't there, in here? There's a serious smell. Oh, and actually, look.
Oh, lovely.
I wonder what the smell was, and there's the answer. Who's the culprit for that?
Which one?
Hey, who's looking sheepish? Walking into Sally's house, straight away I'm hit with a wall of smell. It's not a good smell. This isn't potpourri. This is the smell of wee. Not a very good start.
Yeah.
So do they both wee around the house?
They do. At the moment, Lily's probably slightly worse. You can actually see it flowing out of her sometimes.
And how often are we talking?
Once or twice a day.
Once or twice a day?
Yeah.
Your dogs are peeing in the house?
Well, they're not peeing, they're dribbling.
Oh, Sal. The obvious problem in Sally's house is that she is wading through puddles of wee. Lily has urinated on the floor and she doesn't know that she's done it, and that's clearly a worry. Yeah. Can I have a little feel of you? All right. Sal, is there ever any blood in the urine at all?
Not that I've noticed.
Okay, so it just looks like normal old wee.
Yeah.
Okay.
Yeah.
Just inappropriately positioned.
Yes. Usually on my lap.
Seriously, they wee on your lap?
Yeah.
Oh, that's
But
grim.
they don't wee, they dribble.
I love the way that you're making excuses for them, which is lovely.
I know.
But your version of normal is not normal.
No.
Having an examination of the two dogs, I can see they're very healthy and they're clearly much loved. But there is a problem here. I'm not sure what it is. It could be a congenitally inherited condition that they've had since they were puppies. It could be infection. It could be hormonal urinary incontinence. There's a lot of question marks here. So what I need to do is to take both dogs into the practice where I'll understand exactly what's going on. Come on, let's say bye to Mummy.
Bye-bye.
See ya. Bye.
Bye-bye. Bye-bye, girls.
Off to the practice with you. Come on. Yes. Try and cross your legs for the journeys, would you, girls? Yeah? Thank you. These girls are weeing all over Sally's house. So Jess, if you want to take her through to X-ray.
Back at the practice, Scott is going to X-ray both of Sally's dogs, starting with Lily. But first, a special dye is being injected, which will outline the urinary tract and show up any abnormalities.
Right, X-ray. We take a series of X-rays. It will look a little bit like a roadmap of the urinary tract and see if there's any reason why these girls are incontinent. It's weird. Very strange indeed. I'm doubting myself now because I'm just doubting what I'm seeing on X-ray. The X-ray looks like there's one kidney, which is pretty strange. And it also doesn't really explain why the dog's incontinent. Establishing that Lily doesn't have a left kidney, I don't exactly know what to think of it, and it's certainly not something that I was expecting. I then moved to do an ultrasound on Pickle because I just want to make sure that she does definitely have both kidneys. Okay, so there's one. Yeah, and there's the second one. Thankfully, she does, but I still feel that as these sisters are genetically related, and the problem with Lily is likely to be a congenital abnormality from birth, they can both share similar issues. Good girls, that's it. Come on, come on. Where's Mummy?
No, babe.
Hello,
Owner Sally
Mummy.
has arrived, hopeful that Scott has found the reason for her leaky dogs.
I need to sit down after that.
Dear.
So I have done a excretory urography. It's basically a contrast image of the urinary system.
Yeah.
And it seems like Lily doesn't have a left kidney.
What?
Yep. I then just ultrasounded Pickle
Yeah.
to make sure that I wasn't going mad, and I could see that there is actually 2 kidneys in her abdomen.
Right.
But this is clearly some sort of congenital abnormality, so from birth.
Okay.
So we need to send you up to the Royal Veterinary College, where the specialist there will do a CT scan, and they'll give a lovely 3D image of everything that we need to check out and see what's what and what's not. And also do a cystoscopy, which is basically where they put a camera into the bladder and they have a look around, not only to see where the ureters come from the kidneys into the bladder and where they drain.
Yeah, okay.
All right then, Sal.
Okay, well, thank you very much.
So now I'm going to be sending Sally and the girls up to the Royal Veterinary College, where the specialists will be performing some more tests and then hopefully try and fix them. Bye, mate.
Bye-bye, Scotty.
Bye.
Mwah. If he wants them to go up there, they'll go up there. Trust him implicitly. But, yeah, I'm worried. Go on then. Let's go.
Scott's now taking a break from his London practices and heading west to Wales to polish up his skills as a farm vet.
I'm really excited to be heading out to West Wales again. The people that live out here are absolutely awesome. They're so down to earth and they're really dedicated to the animals that they look after. So I'm honoured actually that they've asked me to come out and help.
Scott's first stop will be the historic town of St Clair's.
Now, last time I was here, I really had to earn my stripes as a farm vet, doing things that I haven't done since my uni days.
He's got a lovely temperament.
Yeah, I can tell. Oh, man.
We'll make a farm vet of you yet, Scott. Welcome to Wales.
This time I'm going to have to step up another level because it's all hands on deck. The vets are so busy this time of year, so I just hope that I can keep up with the pace.
Scott will be based at the Market Hall Practice, which looks after local pets as well as animals at surrounding farms. And he's checking in with head vet David Stark.
Morning, David.
Good morning.
How are you? Good to see you again.
Great.
So what have we got planned? Lots of carvings, lots of sheep, lots of cattle, hopefully lots of horses.
Yeah, loads lined up for the week, Scott.
All right, well, I've got some overalls in the car, I promise. So,
Great.
Should I
Good.
go and chuck them on?
Yes.
Awesome. Great one. Nice one, Dave. Good to see you.
Scott. Cheers.
Scott's being put straight to work after a call about an emergency at a local dairy farm.
A Jersey cattle owner has called to say that one of her girls is very sick. All we know is that this poor girl isn't eating and she does have a calf.
Scott will be working under the guidance of vet Vicky.
Right, time to get suited up.
Yep.
She deals with big farm animals on a daily basis.
What we need?
But Scott hasn't done any major procedures on a cow since his university days.
Oh my goodness, here we go.
Waiting anxiously is dairy farmer Helen. She's worried about her much-loved cow Athena, who's recently become a new mum.
She just looks generally miserable and not happy with life. We never have problems with calvings, the Jerseys. So I'm a little bit nervous.
Hi, I'm Scott. How are
Hi,
you?
I'm Helen. How are you?
Hi, Helen. And who's this gorgeous beast?
This is Athena.
Athena. Very beautiful. Right, so what are the issues that you've been having with your cow?
She's been calved just under a week, and we've noticed the last few days that she hasn't really been eating as much as I'd like her to. She just looked a little bit depressed.
Right. First thing, let's have a little listen to her heart. That's all clear. So I'll just listen to her stomach. Oh, do you want to have a listen?
There's not a huge amount of noise going on in there.
It's quite quiet.
Yeah.
That rumen's not moving.
Yeah. So it's just not functioning at the moment. Yeah. All I can hear is complete silence, and that's a real concern. The 4 stomachs inside a cow should make a lot of noise, and when they don't, that's a worry. I believe that this cow might be suffering with a condition known as left displacement of the abomasum, or LDA. It's basically where one of the 4 stomachs is twisted and can commonly happen after a cow has had a calf. The way that LDA is diagnosed is by using percussion, so basically tapping on the side of the abdomen of the cow.
You hear it?
Oh, wow, yeah, there.
There.
Oh, yeah. Wow, that's amazing. That is a lot different to the surrounding area. It's a very distinctive sound, isn't it?
Yeah.
We can hear a very tinny sound, which basically sounds like a bag, which is the abomasum, filled with gas. So it sounds a little bit like a drum. So pretty much part of the stomach that's here needs to go over there.
Yeah.
And the only way to do that is by reaching in,
Pulling it back.
pulling it out. Athena at the moment's uncomfortable and she isn't eating and she will lose weight quickly, so we need to intervene with this surgery.
First, I just need to do a little local.
In Wales, Scott and farm vet Vicky are about to begin critical surgery on new mum Athena.
You're not going to like this, yeah? You're going to jump a bit.
She's being given a numbing injection in her side, but she'll be awake throughout the procedure.
Good girl. I know. If a large animal is calm enough and quiet enough with just a light sedation and local anaesthetic at the site of the incision, it's far better for them and it's far safer as well. Some nice happy drugs for you, sweetie.
After carving, the much-loved Jersey cow has been left with a badly twisted stomach.
One of her stomachs is full of gas and has moved to the wrong place. So we need to get that back in the right place. But sometimes you can open them up and they've been twisted for a long time and the abdomen has started to react. So until you open them up, you don't really know what you're going to find.
First, Scott and Vicky need to release the trapped gas before moving the stomach back into place.
Good to go?
Yep.
The procedure will be performed through an incision made in Athena's side.
So I'm always nervous when surgery is involved in any animal. We haven't had a huge amount of them done here either, so from an owner's point of view, it's a little bit nervous to watch it happen, yeah.
I can just feel across and I can feel a nice big stomach on the other side.
Right.
So now we're going to deflate the stomach.
So this is quite a dangerous moment, really, isn't it, Vicky?
Yeah, this is quite a big needle, and idea is we want to just take the needle across, put it straight into the abomasum and get the air out.
Back in my uni days, we learnt about farm animal stuff, but it's about 20 years ago, so I do need to refresh my skills with these fantastic farm animal vets.
So if you're going to stab anything, stab yourself.
Right.
So you want to take that?
Yeah. So
Guard it.
I just want to keep that on there and guard it with my life.
Yeah.
All right, Athena, you can trust me, sweetie.
So round the intestines.
Oh my goodness, that is actually quite hard to do.
Yeah.
Without stabbing yourself.
Yeah. So once we open up the cow, you're going in blind. It's just experience and knowing what's normal and navigating under and round, quite important bits of anatomy.
And then?
Just straight in.
Straight in?
As far as you can.
Okay,
and then
it's going in now.
There we are. So the gas that comes out, that's basically fermented grass. That's what they're eating at the moment. And it's sat there for a good couple of days, so it's quite rancid kind of smell, really.
My heart is actually going, doing that. So that's frightening, is performing a procedure like that, a massively sharp needle around this poor girl's organs.
Protect the needle, bring it back out.
Okay, yeah. Oh, okay, please don't move. Okay, good girl. There we go, there we go, there we go, there we go.
Brilliant.
Oh, man.
Fingers intact?
Fingers intact, cow's intact.
With the gas removed, the stomach now has to be manipulated back into its correct position.
So what Vic and I have been able to do is to retrieve the abomasum, which was over on the left-hand side where it shouldn't be, pulled it underneath and then up, and now Vicky's busily lassoing it to this right-hand side of the cow. And what that does is means a little bit of scar tissue will form. It'll stick the stomach where it should be on the right-hand side, and hopefully it'll never flip where it shouldn't go again.
So pull that tight. It's nicely
attached to that
attached there.
wall.
So you just need to stitch the skin.
The suturing of a cow is actually really quite difficult because what we're suturing is leather. So it's very thick and very tough to get through. But at the same time, you want to get a nice, pretty result so that the farmer's happy, just like our owners back at Richmond. All right, last one, sweetheart, last one. That's it.
Yeah, all zipped up.
Very nice. Lovely.
Right.
An antibiotic spray completes Athena's treatment.
Great, good job.
Athena is immediately looking so much brighter. She just looks like a different cow already. I was really happy with how Scott and Vicky worked together to get it done. So it went really well. It couldn't have gone any better.
Before Scott leaves, he wants to see how Athena's 6-day-old calf is coping without his mum.
This is Athena's son, Achilles.
Hello, mate. Oh, hello, beautiful. Whilst Mummy was getting surgery, you didn't get your breakfast, did you? Hey, no, you didn't. Here we go. You gonna have some? There you go. There's the good stuff right there. Oh, yummy. Good boy. It's been a really incredible day today to be able to work alongside Vicky and to help Athena and now to feed this adorable little youngster. It's been a great end to an absolutely perfect day, and now I can see the benefits of being a farm vet. Pretty nice, really. Well, they seem to enjoy that, and hopefully Athena will be able to do the job moving forward.
Yeah, she's already looking a lot brighter, so hopefully he'll be back in with her tomorrow morning, hopefully, to just have a little bit of a sack, and then she can go out with the rest of the cows then.
Yeah, unless you want to come home with me, eh? Eh? Yeah.
Come on, good girls. Let's go find out what today's got to bring, shall we?
Back in town, Sally has arrived at the Royal Veterinary College with her 2 bulldogs, Lily and Pickle.
Come on, Lou. Good girls.
Hi there, Sally.
Hi, yes.
Hi, Stein.
Hi, Stein.
One of the internal medicine specialists with my team.
Hi, team.
And these are Pickle and Lily.
That's correct.
Did I get it right?
Yeah,
yes,
you did.
very
Well
good. And they are weeing in inappropriate places, right?
They are weeing everywhere.
Very good.
Yeah.
So
Yes,
up to us
not
to
very
figure
nice.
out why that might be happening and see
Please.
whether or not we can do something about that.
Pretty please.
Very good. Shall we get a room?
Yeah, let's
Thank
go.
you. Follow us. Come on, Pickle, Lily. Here we go.
Come on, girls. Pickle and Lily are incontinent. We thought it was just a little bit of dribbling here and there, but it's getting worse as they're getting older. They're now starting to lie there and, yeah, it's not very pleasant, basically. Nice damp floors, nice damp sofas, house smelling of pee. It's, yeah, getting a little bit unpleasant.
Hello, you.
Internal medicine specialist Dr. Stein Neeson will be in charge of the investigation.
And we can see the problem in action here, with already a puddle being created. So I see many of these cases on a yearly basis, but Lily poses a real dramatic case with the urine dribbling in front of my eyes on the examination table. I can't imagine how difficult it is to have Lily in your own home. So we definitely need to try and fix this. Right, we need to figure out what the detailed anatomy is of both Pickle's and Lily's urinary tract, because something is preventing both of them to keep the urine in the bladder. So I would suggest that we use a CT scanner to really get down and dirty with the anatomy of both Lily and Pickle's.
What started off with just being a few dribbles is now turning into puddles, and I think before long we'll be turning into lakes.
Lily is first in the CT machine. When Scott x-rayed Lily, he discovered she had only 1 kidney.
So the fact that Lily has only got 1 kidney is slightly odd, but that sort of gives me a hint that I should be open-minded as a vet to look for other abnormalities that Lily was born with. The one point that I'm looking at here is this white dot, which is the tubing that normally goes from the kidney to the bladder. What happens here with Lily is that this tubing is actually ending up very, very late into the urinary tract in the bit that we call the urethra, which is not in the bladder anymore. So that explains perfectly well why Lily is incontinent, because if your urine goes not into your bladder, but into your urethra, there's no mechanism to stop it from coming out.
Now it's Pickle's turn to be scanned. Unlike her sister Lily, Pickle was born with both kidneys.
So we've just done Pickle's CT scan, and we've got a double whammy. Pickle does have 2 kidneys, and both kidneys are ending up putting the urine in the wrong place, way too far back. So Pickle has got the same problem as her sister.
It's time to break the news to owner Sally.
So they both have an ectopic ureter, which basically means that we've got a bad connection between kidney and bladder. And we are going to try to create a good connection once again. And the strategy we will be looking forward to trying to use is a laser technique.
Okay. So basically you're talking about rewiring my dogs?
Yeah, well, replumbing actually.
Fair enough. This is absolutely brilliant news because it's something we can actually do something about. Yeah, what I really didn't want was to be told that this was behavioural and then it's something that's out of my hands, but this is something that we can actually work on.
Surgery on both the dogs will be scheduled for tomorrow.
Not quite home and dry, but certainly hopefully a lot drier than we were before.
In Wales, Scott's next job is with vet David at a local sheep and cattle farm.
Okay.
Yeah.
Yeah. Hello.
All right.
Hi, I'm Scott. How you doing?
Good. Scott, this is Hugh.
Hey, Hugh. How are you?
Good, thanks.
So I'm guessing cattle here?
No, they're down here.
What's down here?
Oh, let's go have a look, Scott. Here they are.
Okay. Sheep.
Yep.
Seeing that my patients are sheep, it does make me quite nervous. We don't have many sheep running around the fields of Richmond.
Yes, we've got 2 rams here.
Okay.
And Hugh has asked us to come along to turn them into teaser rams for him.
That means that we need to give them a rather indelicate cut, don't we?
Yep.
Yeah. A teaser ram is basically produced when they get a vasectomy. That means that they can no longer make babies. So basically, they encourage all the ewes to cycle at the same time so that when the real ram comes in, all the females are receptive and then the lambs are born around about the same time of the year.
Scott, while you catch them, I'll go get my gear ready. These rams are quite tough and they're quite agile. And Scott has got his work cut out.
Good luck.
Good luck.
I can relate, boys. My wife's trying to convince me to do exactly the same thing we're about to do on them. Ouch.
Okay. Let's go. Come on.
One thing I do remember about sheep is they can be quite feisty, they can be quite grumpy, and they're very good at kicking.
Oh my God. He's bloody strong.
In Wales, Scott is trying to catch a ram so he can perform a vasectomy.
Oh my God. He's bloody strong.
Hey, Scott, you're the wrong one there.
Hugh is a classic example of a Welsh farmer. Great sense of humour, great fun, very hospitable.
Not funny, Hugh. Not funny.
But more than happy to let the city boy go in and look like a fool.
Okay, come on, mate. Wait.
He's not the best at handling sheep, I'm not saying, catching them, but he managed, just about. It was a bit funny, it was a bit entertaining.
I wouldn't want to go over there either if I was you. Come on. He really heard what we said we were going to do to him. You can tell he's not keen. On a farm, we have to make do with what we've got. So using a hay bale as a surgical table is all we've got. And obviously it's not the most sterile environment, but we wash up and we scrub up and we clean things as best we can. Right, so if you feel the cord, Scott, you can feel the part we want to cut out, the vas deferens underneath there.
Yeah, so you got the spermatic cord, which is the blood supply, and also the tube that allows the sperm to come to the outside, and that's the one we want to cut.
That's the one we want to cut. But there's a whole lot of blood vessels coming down here, so we have to avoid the blood vessels. Otherwise...
Yeah, complications.
There we are. See, it is quite a delicate operation, isn't it?
Yeah. Just in there.
Yeah, that's it. That's it. I think you've got it now. That's it. Yeah, that nice white fibrous cord. Bring that out, and then.
Okay. Should we close this boy up?
Right.
To name this ram Scott now, then?
That's right, I think so.
You're going to name it Scott now?
Definitely.
Yeah.
Okay.
Scott, no chance of having any lambs.
Come on, mate.
Up you get. Come on, good boy.
There we go, good boy.
Well done.
You'll soon recover, Scott.
Yeah.
Yeah.
All right.
Yeah.
We're quite asleep already, so
We're pretty chilled.
A world away at the high-tech Royal Veterinary College, bladder surgery on incontinent bulldogs Pickle and Lily is about to begin. Their condition is rare, so they've been brought to the RVC, where Dr. Roseanne Jepson will perform specialised laser surgery.
Both Lily and Pickle have abnormalities in their urinary tract, so they have tubes that connect the wrong components together, essentially. And what we're going to do is we're going to use a laser to try and correct those changes. Laser is a really exciting form of surgery because it's minimally invasive, and this is one of the reasons it's attractive not only to owners but also to the pets themselves, because it means that their recovery time is much, much faster. Okay, I think we're ready to start.
Lily is first to undergo the procedure. Dr. Roseanne and her team are using a camera to explore Lily's urinary tract.
So the kidney that she does have is her right, which would fit with that being the opening to the right ureter.
So we're about to start lasering. So we're going to laser the abnormal band of tissue between where the tube from the kidney down to the bladder should be, and essentially open that out so that the urine comes down that tube into the bladder rather than opening out in the urethra where it is at the moment. Stop. Yep.
Okay.
So we've been able to laser the little bit of excess tissue that was present. We did find one slightly unusual finding was that she had a very small blind-ended tunnel, which may have been the opening of the ureter from the kidney that doesn't exist. But so far, so good. Procedure has gone as we hoped it would.
Now it's Pickle's turn for the high-tech laser surgery.
In terms of the procedure, it is quite technical. Every dog is very different, and so the same would be true for Lily and Pickle, and that creates some of the challenges that we have with this procedure.
Although Pickle has both her kidneys, she shares the same genetic abnormality as her sister, which means her internal plumbing is faulty and she constantly leaks urine.
Okay.
So both Lily and Pickle's procedures have gone very well today. We'll have to see how well they recover, and the next sort of 24, 48 hours really will tell us whether they're going to be continent after this procedure or not.
In Wales, Scott's next job is going to be a challenge.
I've just had a call from Philip, one of the vets, who needs some help with some horse dentistry. Now, as a small animal vet, we do dental work on dogs and cats all the time, even rabbits occasionally. But my horse dentistry, it's really quite rusty. So I'm really glad that Philip, as an experienced vet, is going to be on hand to help.
Waiting for Scott and Philip are friends Sue and Cher, and elderly mare Folly.
See what sort of mood she's in today? Folly! Hello, baby. I've had Folly 28 years now. She was my first horse, my dream horse. Yeah, I love her to bits. You're such a good girl, aren't you? You're going to enjoy the dentist today. Her dental appointment, I believe, she doesn't mind too much. Good girl. She tends to be quite relaxed about it, and sometimes she actually looks like she's enjoying it. Come on, then. Oh.
Hey, Philip.
Hi, Scott, how you doing? I called Scott today to give a hand with these horses. I thought it'd be something totally different for him and something he could get involved in.
How's that there?
Also, it's just handy to have another strong person there to help hold the horses.
Nice to meet you. Hi, I'm Scott.
Nice to meet you.
Hello. Hi, you're Sue?
I'm Sue.
Hello.
I'm Cher.
Hi, Cher. And I've heard this gorgeous creature is Folly.
It is Folly.
Hello, beautiful. They say it's a bit rude to ask a lady her age, but just by the look of her, she looks like she is quite mature. Is that fair?
She is mature, like her owner. Yeah, she's, Folly's about 38, 39 now.
Are you? You look absolutely gorgeous. Folly is so beautiful. She's got the most gorgeous blue eyes, and she's one of the oldest horses I've ever met. And being that she's a little bit, pardon the pun, long in the tooth, she's getting some dental work today.
She is, yeah. She hasn't got any problems that I see at the moment, but I still make sure that everything's right in her mouth and she's comfortable.
Yeah. Horse dentistry is really important in domestic animals because domestic horses live a very long time. Normal horses in the wild live to maybe 20 or so. So the older you get, like with us, the worse your teeth get. So, Philip, this is Folly, the ripe old age of 38.
Wonderful, isn't it?
Yeah.
Really good how some horses just keep on going.
Yeah.
And she's looking really good for her age, too.
She is. All right, so got to put this one on.
Yeah, if you just extend it.
In order to be able to examine a horse's mouth properly, we need to place a gag, which is a large metal contraption. It allows the mouth to be open wide so it can assess the teeth, we can assess the gums and the tongue as well. So what do you look for first in the examination, Philip?
Just check all the teeth, just like your own dentist would do with you. Just goes round the whole mouth.
So you're feeling for sort of sharp edges, are you?
Basically, yeah. It's important that we check anything in the mouth that might be causing the horses discomfort and stop them eating properly. And also, old horses to be in danger of losing teeth, so we need to keep on top of what's happening in their mouths. Oh, yeah. Oh, she's got what's happened there? Ah, she's got a broken tooth. And there it is.
Oh, my gosh.
Whoa.
Yeah.
That is huge. Whereabouts is that come out from?
It's halfway along on her off side.
Okay.
Yeah.
Halfway along?
Yeah, on the bottom.
My goodness. So it was a bit shocking seeing that drop out of her mouth.
You can see that root there has gone rotten. It's just
Yeah.
come away.
It is quite confronting to see a tooth just come out of a horse's mouth like that. But for Folly, she's an old girl, and to lose a tooth at her age is quite normal. And the good thing about it coming out whilst we're here is that we're able to check for any underlying problems. I think that feels okay. It's not really impacting on any of the other teeth, and it's not infected. It's not seemingly causing her any discomfort.
Yeah, I'm happy with that.
The next stage of Folly's treatment is a procedure called floating.
Put a bit of downward pressure with this hand then on the handle.
Using a coarse file, Scott will shave down any sharp edges on Folly's teeth.
Yeah, you really have to give it a bit more force than you'd imagine. Good girl. Again, it's just about not taking up too much, isn't it?
Yeah, that's right. If you want to do the same then on the bottom.
Folly, you're being a very good girl.
She's very patient, isn't she? She's just so good. She's such a good girl.
Oh, okay, baby. There we go. I mean, have a feel, Philip. I think that feels okay.
I'm happy with that.
I think it went very well.
Yeah.
Folly was happy with Scott. She seemed quite relaxed with him.
Oh, yes, she did, yeah.
She did, didn't she?
Yeah.
Oh,
There you go, baby.
Okay,
Good
girl.
Thank you, guys. She's going to feel much more comfortable now.
Now we're done with Folly's dental procedure. She's got a perfect smile. I think it's only fair. She's been a good girl at the dentist. She deserves a treat. There you go. Hey, don't tell Mummy. Don't tell Mummy. Yeah.
Good. Ho!
It's a busy time for the farmers in the area, with everyone getting ready for the local agricultural show.
Go then.
For Farmer Clive, it's an especially nervous day.
It's my lifetime's work breeding cattle, and it's my father's lifetime's work before me. And the best barometer of judging the quality of your herd is to take them out and compare them with other people that are trying to do the same thing.
But several years ago, Clive's farm was affected by the highly contagious bovine TB.
Hi.
Bovine tuberculosis in this part of Wales has been a major issue. It's a serious problem because it's a disease that affects the lungs and lymph nodes, and there is a risk.
Although the farm is now free from the disease, Clive's herd still has to undergo regular testing.
Bring the other one in as well.
And head farm vet David has just arrived.
Okay.
Bovine TB is spread by infected badgers, and the ramifications for farmers like Clive are enormous.
Just the physical having to test the whole herd every 60 days is it's a nightmare.
7, okay, that's great.
You have to keep doing it until the government find a way of actually getting rid of it so that we have healthy cattle and healthy wildlife.
Ooh, it's a bit of a worry. I'll have to check, Clive. I'll have to
Yeah,
check as well.
fair enough.
If the tests return a positive result for TB, Clive's cows will be ineligible to be entered in the local show.
All right, 7. Let's check the bottom. 7, good.
Good.
That's great.
Happy days.
Yeah. It's such excellent news for Clive. And I'm also relieved because as a vet, there's nothing worse than bringing the farmer bad news. So to be clear today, it's a big relief. She's fine, she's clear.
Great.
Good.
Sinclair's show, here we come. It's really good news. The cows are clear to go for Sinclair's show tomorrow. A bit of elbow grease using them tonight and a spit and polish and get them look as good as possible. So I'm very, very happy.
Do you reckon they're a bit better?
I am covered in your hair, Lily.
It's better than being covered in her urine.
In Teddington, 2-year-old sisters Lily and Pickle have recovered well from the laser surgery on their leaky bladders.
Both of them seem to be plumbed in a little bit weird. So basically the ureters weren't quite going where they should be, which meant what you were pouring in one end was pretty much coming out the other. Ready? Coverage!
Sally was hopeful that after the high-tech laser procedure on both the girls, her days of endlessly cleaning up after them would be over.
Which body? Which body? We were always told it would be a 50% success rate, and it was a 50% success rate. One of them's working, and the other one, unfortunately, seems to be a little bit better, but certainly not where we'd hoped. So we're very pleased with the fact that Lily's now totally dry. It's fantastic. And we're very hopeful that Pickle, with a bit of medication, will have a nice dry dog at the end of all of this. So fingers crossed.
Sally is staying positive.
It has made a difference. I only have to wash the sofa covers, twice a week instead of 4 times a week.
Scott's stint in Wales is almost over, but the locals have asked him to help out with something very dear to their hearts.
After a fantastic and exhausting and exhilarating week here in Wales, I'm here at the Sinclair's show. It's all the great farmers of the area coming together with their beautiful animals to show them in the ring.
The agricultural show is the highlight of the farming community's year.
The Sinclair's Agricultural Show is a family show, it's a community show. It's been running now since late 1800s. We seem to be going from strength to strength.
Morning, Clive.
Morning, Scott.
Scott is keen to meet dairy farmer Clive.
Say hello, ladies.
His cows have passed TB test, and now he's hoping for a win in the ring.
And what's the general sort of physical attributes that they're looking for in a winner?
In a winner, you want a nice, tall, fine-bodied animal.
We're talking about cows, right?
The cows,
Okay.
yes, we are talking about cows.
Just checking.
But you want a good-looking cow.
Yeah.
It's nice to have a good-looking woman on your arm as well. Isn't it?
Well, absolutely.
The cows will need some last-minute spit and polish, and Clive has roped in Scott to help.
All right.
Don't let go.
Okay, I won't. What's her name?
Tunisia.
A very fancy name for a girl from Wales, isn't it? I'm feeling confident for Clive, and I really hope that after all the bad luck that he's had, he can have a win here.
shampooing a cow, so...
It's not something I've done before. I just thought when a cow would come, they'd be cleaned first, but in fact, they don't travel well.
And I want her shining.
You want her shining?
Oh, I don't want to see any muck on her whatsoever.
Mizzy, you and I are going to have words. A bit like when you used to earn your pocket money and you have to wash your dad's car.
I'm not giving you pocket money.
I don't even get pocket money. Great. I've never actually had to shine up a cow before, but she seems to be enjoying it, and in fairness, she looks awesome. Hey, you ready to go? Ready to hit the ring? I'm really hoping today that I get to walk one of the cows into the ring. It'll be quite an honour to be able to do that, and I'm wondering what technique there is. I kind of remember the dog ladies at Crufts that sort of have that jaunty little run as they run in with a big smile on their face. So I'm hoping it's something similar, and I hope that I do Clive proud.
Are you all right there then, Scott? Back there?
Oh, yeah, never been better. Yeah,
right.
Yeah.
You know,
I hope no one's watching this.
Make sure it doesn't miss the bucket.
Yeah.
And I warn you, if she coughs...
Great.
Yeah, I'll be okay.
Good luck.
Tunisia's been entered in the cow with calf category, where judges will be looking for a wide body, strong legs, and big udders.
Oh! Clive's cow decided to have a sit down mid-walk, which was lazy at best, but she's still looking beautiful.
And she's caught the judge's eye, making it to the final 2 in her class.
There you go. All right. Thank you.
Ah, well done, Clive. Good job, mate.
Second prize for today. She's a cracking cow that beat me, and they both looked very well in the ring, so I was quite happy. Scott's a good help. He's marvellous, you know. I couldn't manage without him. He'll have to come every time I go showing.
Scott's now back on more familiar territory.
Wow, there are some very strong contenders.
The organisers have invited him to be the guest judge in the canine novelty section.
Everyone smile.
Everybody was booked in to have their hair done, ready for Scott at St. Clair's show.
Oh, you're so pretty. Your dad's done a great job of your coat. Look at that. You're a bit grumpy, but you've got very nice eyes. Wow, that must have taken some work, I would have thought. There's lots of things that I'm looking for as part of this competition, and it isn't just about doggy good looks. I'm looking for healthy body condition, a lovely, shiny, silky, well-groomed coat, beautiful white teeth, and even their age.
She's one of the oldest Leos being shown in the country.
I thought she was a Leonberger. She's gorgeous.
She's 9 in a couple of weeks.
Such nice dogs you've got in St. Clair's, haven't you?
How well the dogs perform in the ring is also important.
Very nice. Very pretty girl. Some stiff competition there.
Before Scott announces the winner, he needs to award the runner-up.
Reserve champion goes to our lovely old lady right here. Congratulations.
Thank you.
Congratulations. Well done. Well done. My pleasure.
And now it's decision time for the all-important Best in Show.
Well, firstly, can I say you're all winners, and they're all fantastic dogs. But the winner of the St. Clair's Agricultural Show 2017 is the Bernese. Congratulations. Well done. Good job. Well done. Good girl. Here we go. That's yours. That's yours. Should I put it on you or the dog? I'm going to put it on you. You can just say you're the champion of everything. There we go. Well done. Congratulations.
Thank you. Good girl. I do watch him on the telly. It's not every day you want to cuddle with a celebrity, is it?
The 139th St. Clair's show has been a resounding success as Scott prepares to leave Wales for home.
Hey, Scott, it's been great to have you and the team here again for a few days.
Thanks.
I think we've all enjoyed it.
Thank you. Well, I've really enjoyed myself, and hopefully I've impressed you with my farm skills a little bit.
Yeah, Scott, I think slowly we can see the farm bed emerging in you.
Boys, it's been a pleasure.
Our pleasure, really good.
Thanks for having us.
Great having you again.
Cheers.
Hope to see you again soon.
All the best. Bye.
Okay, David. Yeah,
Let's
go
go
for a
drink.
beer.
Yeah.
Come on.
I've absolutely loved my time here in Wales. The country people and their relationship with their animals is just so special. Today,